Come as you are, and we'll adjust to you.
Super sites like the RBC Convention Centre in downtown Winnipeg can be bright and noisy. And as a result, for some parents who have children with autism or other sensory sensitivities, they were worried that accessing the COVID-19 vaccine may be something that just isn't happening. But now, thanks to the help of Amant Centre, some of those parents have been able to breathe a sigh of relief.
Without this option, they were thinking that their child would never be able to get the vaccine. We heard from families who said, I can't even imagine what it would have been like to take my child to the super site at the convention center.
The clinic, hosted by Amant Centre, saw roughly 170 doses of the vaccine administered, and the vaccine clinic lead says the rollout for children should also be accessible for kids with unique neurological needs.
If the goal of your clinic is to give as many doses as possible, I think sometimes you lose sight of those special kind of sensory needs that some kids have.
She says everyone, not just the provincial government, should be working to ensure those with neurodiversity can be protected against COVID-19. And she says there's opportunity for both government and independent vaccination sites to partner with groups like Amant to offer the important service.
We're here as a resource as well as kind of a provider.
She says children with sensory sensitivity may also not be able to wear masks or sanitize as often, saying the extra level of protection is critical.
What's at stake is the health of our children in Manitoba. What's at stake is kind of the well-being of families and that sense of relief a parent gets when they know their child is as protected as they can be.
Wear a short-sleeve shirt.
Earlier this week, provincial officials gathered at the RBC Super Site to kick off the official Protect MB Kids campaign aimed at children 5 to 11, with the medical lead for Manitoba's COVID-19 vaccine task force stressing the importance of the shot for children.
Every parent wants to do what's best for their child. The challenge is sometimes it's hard to know what's best. In the case of the Pfizer pediatric vaccine, fortunately, it's not as hard to know what's best. We have a lot of evidence. We have the science telling us, we have the research telling us, information that has been proven without significant doubt.
For those advocating for people with autism in the province, they say accessibility is something that needs to be considered at the foundational level, with the Manitoba chapter of Autistics United Canada saying in a statement, the medical system needs to do more to accommodate people with disabilities, and one of the best ways to do this is to consult with disabled people when building the systems that we interact with, such as vaccine clinics. The team at Amant is set to meet on Monday to discuss plans for future vaccine clinics. But they say with roughly 180 appointments filled in less than 24 hours, the need for this type of specialized site is obvious and clear. They also want to stress that the vaccine clinic isn't just for children with specialized needs, saying this is to ensure that siblings can get the shot together. In Winnipeg, Morgan Majeski, City News.